Hi Lauren, I'm Annabelle. I'm
Hi.
a student nurse. I'm going to be teaching you how to perform a blood glucose level on a patient today.
Yep.
So firstly, I would gather my equipment, make sure I have everything, and then I would perform hand hygiene.
Yep.
And then before doing any procedure, I would always introduce myself, gain consent from them, and I would explain the task which I'm going to be doing. And then, okay, so we have the machine and the lancet, which we prick the finger with, and then we grab the test strip, making sure this isn't out of date and that the number is calibrated with the machine. Also, we would get the patient to alcohol swab their finger, but it's preferred if they do hand hygiene first. And we would also grab a band-aid and a cotton swab just to apply pressure to where we prick the finger so they don't have any additional bleeding. Okay, first of all, I would get my patients to alcohol swab their finger, their preferred finger, and whilst they're doing that, I'm going to grab the test strip and open it up, putting this end inside the machine, waiting for the numbers, and then we're going to match this number with this one on there so it's properly calibrated. And then we wait for the finger to dry. Yep, it's dry. Then we're going to grab the lancet and prick in the finger and get some blood. And then we'd place this end of the strip on there, gathering the blood, waiting for 20 seconds, and just apply that to your finger. Waiting 20 seconds for the reading, and depending on the reading, we can give additional insulin, or if it's really low, we can use the hypo kit to help the patient's insulin levels to be higher or lower. Okay, and after you've performed the task, you would get your patient's chart and record it in there, and then it's in there, and if you know, that will give you an indication whether or not you have to give additional insulin, and if it's really low, then we would use the hypo kit if necessary. Also, when we're doing the blood glucose, we have a hypo kit which has everything in it, which would help us if the glucose level was really low or either really high. And if the glucose level was really low, we would give them a mouthful of this Carbotest, which is a short-acting sugar syrup, which gets their sugar levels up. And to maintain the sugar levels, we would give them a dry biscuit, which would be the long-lasting. And if their insulin levels were their sugar levels were really high, we would give them Nova Rapid, and depending on how high their levels were, would be how much we would give. It might be 3 units or 4 units, depending on how high it is. And that is all found in the hypo kit, so it's all together. Okay, and following on from the hypo kit, also if your patient has swallowing difficulties or can't talk and can't eat or anything, we would use the injection, subcutaneous injection, which would be easier for them, much easier. So there's always 2 options if your patient can't eat or swallow.